Okay, so there's a few things that we can see right off the bat that we've already seen before. Number one, that supraorbital nerve, which is going this way. Okay, use a different color. And then, of course, that supratrochlear nerve. What we're going to see this time on our list as well is something called the infratrochlear nerve. The infratrochlear nerve, when we see it, is going to exit out here and just kind of come into this area right through there. We're not really seeing it on this model. Of course, here we have the infraorbital nerves down there. Now, if we look right through here, we can see this little ligament right through there. This is the lateral palpebral ligament. And this guy right through here, this is the medial palpebral ligament. Okay, so this is the medial on this side, and of course this is the lateral on that side. Now again, here we can actually see that infratrochlear nerve right there. So that's what we're seeing right through there, that infratrochlear nerve. And of course, this guy's going to be our supratrochlear, and of course, again, that guy's our supraorbital nerve that we're seeing there. Now here we're seeing that orbicularis oculi muscle that's covering over this. Now this portion right through here is the palpebral portion. So just a second ago, we saw that ligament, right? We saw the medial palpebral ligament and the lateral palpebral ligament. Just something to keep in mind. It's just kind of underneath those structures right through there. Now, if we look at this image right through here, we can appreciate that trigeminal nerve. Remember, we said trigeminal nerve has those three different branches, right? And one of those branches we're coming this way, just like this, okay? Now, we're getting ready to follow the pathway of that nerve. Now, I'm showing it to you here because there's two things we can see it do. One, we'll see it exit as that supratrochlear nerve, and then we'll also see it exit as that supraorbital nerve as well, too. Okay. Okay. So again, here's that lateral palpebral ligament. Here is the medial palpebral ligament. This is called the superior tarsus, and this is the inferior tarsus. All right. This is our lacrimal sac right through here. This big thing right through there, that is the lacrimal sac. This is the nasolacrimal duct. So as it's going further down, it's going to go down into here, right? Nasolacrimal duct. And remember, we saw that enter underneath the inferior nasal concha. Right. This is the lacrimal caniculi here. This is it. It's technically two of them, a superior and an inferior, but it just says lacrimal caniculi, so that's all we have to worry about. Up here, we can see our lacrimal gland, okay? And hopefully we'll get to appreciate that there's two parts to the lacrimal gland. One's the palpebral, and the other one's the external portion right through here. And the lacrimal gland, of course, releases tears that get washed away. Now, it's actually going to be innervated by V1 and V2, and hopefully we'll get a chance to see both of those nerves from a different angle. So let's see. Here we can see, we can't really see it, but the continuation of this right through here, as this continues, this ophthalmic division does this right here. This is the frontal nerve. And I told you that that frontal nerve is going to continue. It's going to divide into these two different branches. One is that supratrochlear, and then one will be the supraorbital, going through that supraorbital foramen. Here we can see these little bitty nerves, little guys right through there. You can see it better on other models, but those are the lacrimal nerves right through there. Now we can also appreciate that there's another nerve coming out right there, okay? That nerve through there is called the nasociliary nerve. Now the nasociliary nerve is going to give us a couple of branches, and if you notice, it continues back here underneath. It's going to give us our posterior ethmoidal and our anterior ethmoidal nerves. It's actually going to continue as well too, and it's actually going to exit out of the orbit, and it's going to become the infratrochlear nerve. Okay, we saw where that exited. You can't see that on this model, but that's where it's going to exit. So again, we can see right through here the nasociliary nerve, and you're going to be able to see it going here as the posterior, and there's the anterior. Now, we're also going to see the nasociliary nerve go with this ciliary ganglion. Okay, so that's what that is right through there. Now, this nerve right through here is called a long ciliary nerve, and the nerves that are passing from the ciliary ganglia, those are called the short ciliary nerves. Now, those are going to be going to our eye. Now, there's a number of different cranial nerves that are in the eye, and one of the biggest ones that we can see right here is cranial nerve number 2. So that's the optic nerve. It's this big nerve right through there. Okay. Now, the entire thing that you see there is not the nerve. It's actually wrapped around with some dura, and it has some other stuff that's inside there, like the central artery, central vein, and the nerve itself is passing through there. But if that's tagged, we call it the second nerve, the second cranial nerve. Okay. Now, the other nerves that we can see here is down here. So if you look down here, you can see this. Okay, right through there. That is the inferior oculomotor nerve. Now, all of the muscles of the eye essentially are going to be innervated by the oculomotor nerve, but there's going to be an inferior branch of the oculomotor nerve that we'll find here, and then there's also going to be one underneath here. It's called the superior branches of the oculomotor nerve, so we can see that underneath. All right, and we'll see that on a different picture in a minute. Here's that frontal nerve. Remember I told you it's going to kind of branch. It's going to give us these different guys. It's going to do that. Okay, so we can't really see that well, but that's what it's going to do. And that would continue that way. It's just this model's not complete. So there's that frontal nerve. Deep down here, you can see that part of the nasociliary nerve. And you can see how it's continuing down through here. Okay. Now, one thing we can see here is the levator palpebrae superioris muscle, and that's what this is right here, this big muscle on the very top where we see the frontal nerve. So right there where we see that frontal nerve, all of that is through there. Now, the tendon of the levator palpebrae superioris muscle is this part right through here. So you see that gray portion where the muscle is running in? We can see all that right through there. Again, here is that nasociliary nerve, posterior ethmoidal, anterior ethmoidal, and then we're going to see this guy continue as the infratrochlear nerve and pass out of there. Now, we see another nerve right here. See this nerve right through there? That nerve is actually going to go to this muscle, and it's kind of hard to see, but the muscle is just right here. It's going to go through this little thing called a trochlea, and then it's going to go back and attach to the eye just like this underneath this muscle. That muscle right through there is innervated by the trochlear nerve. So that's our cranial nerve number 4. So the trochlear nerve innervates the muscle known as the superior oblique muscle, and we'll see that in a different setting or a different model. Now, you may notice off to the side that there's a small belly of a muscle right here. That muscle would actually continue out and connect to the eye like this. Okay, and that would be our lateral rectus muscle. And remember, if we're looking laterally, that's the same thing as abducting our eye. So the nerve we would find on the underside here, that's going to be our abducens nerve, known as our cranial nerve number 6. Okay. So here's another image. We're seeing the same thing. But what we can see better is we can see that trochlear nerve right there. You see it? And you see how it's right on top of that muscle. That muscle right through there, this big muscle right through here, okay, that is the superior oblique. Superior oblique is going to pass through this thing right there. It's called the trochlea. And then it's going to kind of hook back and go back this way to actually attach onto the eye. We can also see on the inside here, we can see the retina. That's what that is right through there, is the retina. Okay. And then we can also see this white portion, the white of the eye right through there, that is the sclera. All right. Of course, this thing right through here is the cornea. This right through here, where the number 1 is, the anterior chamber of the eye. This guy right through here, this is the posterior chamber of the eye, like all of this area. This is all the posterior chamber of the eye. This is the anterior chamber of the eye. And there's actually this fluid that passes in between those two chambers. Okay, now of course this thing right through here is the lens of the eye. And these things right through here are these little ciliary muscles, these little things that help constrict, or ciliary bodies that help constrict the eye or dilate the eye, that are attached to all these other parts. And we'll take a look at that on a PowerPoint slide so we can see it a little bit better. So again, you've got the anterior, posterior chamber of the eye, the lens that you can see here, the sclera. Now this layer right through here, this layer, this is called the choroid plexus, and we'll take a look at that from a different model in just a few minutes, or in just a moment. Pretty much the same image. I will point out that this muscle right through here is the inferior rectus. Here we can see just behind that muscle right through there, there's one on the side, that's the middle rectus. Here you can actually see where the inferior oblique would be attaching to the eye. Here you can see where the superior rectus would be attaching to the eye. Now, if you recall, on the other side of this model is where we saw our trigeminal nerve, okay? So this is coming from right here on the side of this model. I just flipped it over so that we could see that lateral rectus muscle. Remember, the lateral rectus is innervated by the abducens nerve. So that nerve right through there that we see there is cranial nerve 6, the abducens nerve. Okay, this is looking underneath the muscle that we saw on top of the eye. So if you remember, that long frontal nerve was going to exit the eye, and then we saw that this muscle right through there, and I know it's taken out of context, but when you see it in lab, it should make sense. That muscle was that levator palpebrae superioris muscle. The muscle underneath that, though, is the superior rectus. And the superior rectus is going to be innervated by the superior branch of our oculomotor nerve. Because remember, everything except for the superior oblique and the lateral rectus, okay? Superior oblique is innervated by cranial nerve 4, and the lateral rectus is cranial nerve 6, but everything else is innervated by cranial nerve number 3. When we look at a model like this, it can be easy to kind of get confused about what you're looking at. But if you always just look for this right there, that lacrimal gland, it lets you know that it's lateral, because the lacrimal gland is lateral, okay? So here on this side, this must be the lateral rectus, right? And the muscle we're seeing here must be the inferior rectus. The one you're seeing go up is the superior rectus. So if you know how to orientate yourself by looking for that, then you know exactly what side you're looking at. Now here is that lacrimal sac, the nasolacrimal sac, or the lacrimal sac. Okay, so that lets me know that this must be the medial side of the eye. So this guy right through here must be the medial rectus, right? And we can see underneath just a little bit of the inferior oblique muscle as well too. Of course, we can see the superior and the inferior tarsus. We can see the iris of the eye here, that portion that's giving us color, all right? We can see the sclera right through there, which is the white portion of the eye, okay? Here again is that lacrimal gland. So lacrimal gland is lateral. So this has got to be our lateral rectus. This has got to be our superior rectus. This has got to be our inferior oblique, right? Because it's underneath, all right? Here we can see the sclera through there. Now, since here we can see that's the lateral side, this side must be our medial side, right? So this is the tendon of our superior oblique. This is our medial rectus muscle right through there, okay? And then that is everything that we can see so far. There's going to be some more stuff we'll see in the lab, so make sure you're paying attention.